really quickly here. I was asked by Tiffany to give an update on the Valerion program, which was the safety and efficacy of VAL-1221, which is a novel fusion protein targeting cytoplasmic glycogen in addition to lysosomal glycogen in patients with late-onset Pompe disease. These are my disclosures. And I do want to clarify that this presentation is based on data and courtesy of slides provided by the sponsor and really does not represent my views. It is industry-sponsored slides. And so I think, as we well know, that enzyme replacement therapy for Pompe disease with L-glucosidase alpha at this time really is via the mannose-6-phosphate pathway. So we have the mannose-6-phosphate receptors for the uptake of the enzyme. And the question that arises in the field, or as brought up by the sponsor, has been that there is also a lot of extra lysosomal glycogen or cytoplasmic glycogen because of rupture or seepage from the lysosomes. And if there was a way to target that in addition to lysosomal glycogen, whether we can have a more efficient result. So the delivery technology that was used by them was using a fusion protein, using a Fab fraction, which is really a portion of a humanized monoclonal antibody, and attaching it to the protein of interest, which in this case is the GAA. And the idea is that this Fab fraction, it's a cell-penetrating monoclonal antibody. So the purpose is then, if you use the advantage of the ENT2 receptor through this monoclonal antibody, you can get the enzyme into two compartments, the lysosomal compartment through the M6P pathway and the cytoplasmic compartment through the ENT2 uptake pathway. So preclinical work done in mice has shown that there's actually an improved biodistribution versus the L-glucosidase alpha in knockout GA mice, and so more uptake in muscle and heart as compared to liver and spleen. And based on that, a 12-week phase 1/2 repeat dose escalation study of this fusion protein in adults with late onset Pompe disease who were previously treated with L-glucosidase alpha were enrolled. And there were three groups, as this was a phase 1 safety study, so dose ascending study. And in each group, there were 4 patients, 3 who received the new protein or the fusion protein, and 1 in each group served as a control and received the RHGAA. So the 3 groups, one received 3 milligrams per kilogram every 2 weeks. The second group received 10 milligrams per kilogram every 2 weeks. And the third group received 30 milligrams per kilogram every 2 weeks. And based on molar strength, the 30 milligrams per kilogram every 2 weeks is equivalent to the dose of 20 milligrams per kilogram of RHGAA. And so the primary outcome measure, given this is a phase 1/2 study, was safety and tolerability. But then there were also efficacy outcome measures looking at 6-minute walk test, the lung function test, muscle strength and function, and also some patient-reported outcome measures. So in terms of the eligibility criteria, I think this has been very similar to the other clinical trials. Adults with late-onset Pompe disease, previously treated with IV L-glucosidase alpha for at least 1 year, having greater than 30 but less than 80% of predicted normal for the forced vital capacity, or having greater than 20 but less than 80% predicted normal for 6-minute walk test. So these were the patients that were enrolled, 11 patients. The mean age was 50 years, previously treated for about 6.6 years, and the range of FVC was 66%, but as you can see, it was anywhere from as low as 19% to upward of 85%. And more importantly, in this particular trial, the sponsor wanted to note that patients with prior infusion-associated reactions on standard of care were not excluded. So in terms of safety, there were no serious, severe, or unexpected adverse events, and the majority of the adverse events were considered mild. And 3 patients who were receiving this, 1 in each cohort, had moderate infusion-associated reactions, requiring management through intra-infusion medications, but none of them had an increase in complement or tryptase. and they all completed the study and opted to continue into the extension protocol. So now looking at the beginnings of there's really malfunction here. Okay, hold on. I don't have a mic now. Okay. I'm going to fix this. Okay, so I think we all have to be careful because these are open label data. But relative to controls, if you take a close look here, each group has been divided. So there's the control group, and then cohort 1, cohort 2, and cohort 3. And the red line represents the mean. So as you can see that the control group, which is the L-glucosidase alpha treated group, and the low dose group at 3 mg per kg, did not show really any change on the 6-minute walk test. There was a tendency towards an improvement in the group 2 and the group 3 patients. And the same applies for GSGC. The GSGC, as we know, comprises of 4 different subsets of scales within it, and the lower the number, the better the outcome. And so you can see a tendency in cohort 2 and cohort 3 towards an improvement that's noted on the GSGC. The next now comes to the pulmonary function tests. And so again, looking at the forced vital capacity, really relative to controls, cohorts 2 and 3 had some improvement on both the MIP and the MAP, whilst only cohort 3 improved modestly on the forced vital capacity, which was expressed as a percent predicted. Now looking at the rash-built Pompe activity scale, again here, this is an 18-point measure scale, and the higher the number, the better the results. And so again, relative to results, to the control group, you can see that the cohort 1 was not doing well, but cohort 2 and cohort 3, that was a tendency towards an improvement in the rash-built Pompe activity scale. Now looking at patient-reported outcome measures, so this is looking at PROMIS measures. This is from baseline to week 12 again. There were 6 different domains that were looked at: anxiety, pain, depression, fatigue, and 2 more, but I tried to punch the ones where the lower numbers are better together. And here, in cohorts 2 and cohorts 3, there was an improvement that was noted in 2 of these domains. And if you look at the social roles and activities where higher number is an improvement, there was an improvement that was noted. So in short, in terms of efficacy, relative to controls, cohorts 2 and cohorts 3 showed some improvement in 6-minute walk test, and in some measures of lung function tests, in functional measures of the GSGC, on the RPACT, and in 3 of 6 domains of the PROMIS measures. So at this point, there is an extension study that's going on, and 8 of 11 patients have been treated for at least 1 year. There are no serious or unexpected adverse events, no other IARs that have been experienced by the patients, and there are 6 patients who actually met certain baseline criteria, and these 6 patients have actually had an improvement of 75 meters on the 6-minute walk test on average. But once again, I really want to point out that this is an open label study, so there's a lot of patient bias and interest in an open label study. So I think the most that we can say in the study is safety, and I think longer term studies are needed, and the sponsor is planning controlled studies in Pompe disease. So that's all I have to say. I want to acknowledge the patients and the other investigators that have been involved in this phase 1/2 clinical trial. Thank you.